Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. Today, I am my own show again today. No guest for today, so it's just me. And today, I wanted to share with you a presentation I'd put together for a community education course called Head Injury 101. And I got to thinking about it, and I really wanted to share it more than just with that community ed group, because it is really kind of a good round way to look at TBI, traumatic brain injury, and see what all are those basic things that we really need to know related to traumatic brain injury. Without further ado, we'll go ahead and get into the show. So my presentation on Head Injury 101, and this would look much, much better if you all were sitting in front of me looking at the images on my screen, because I put together this beautiful PowerPoint presentation and it just doesn't share well on podcast, unfortunately. But here it is, and I will talk you through it as best as I possibly can on this Head Injury 101 Community Ed Now for Everybody course. So basically the things I'm going to cover today, we're going to talk about how do concussions happen, what to watch for with a concussion, what's the newest research in healing, so I'll kind of talk about that a little bit, and then how to advocate for yourself or a loved one, whether you are the person with the brain injury or you know someone with a brain injury that just needs a little bit more help. So first off, what we used to think. So we need to talk about this first. So what we used to think with concussion are several things. First off, we used to think that you had to hit your head to have a concussion. We used to think that you had to lose consciousness to have a concussion. We used to think that most people recovered completely within 21 to 28 days, and there's a lot of research still kind of floating out there about that from 20-ish years ago, that most people recovered completely within 21 to 28 days. We used to think that there were no lasting symptoms unless somebody had a head bleed or a coma. I'll talk about that more. And then mild TBI, mild traumatic brain injury, we thought left no lasting effects. Like that didn't even happen unless you were moderate or severe category. And we'll talk about what that means coming up here today too. So how do concussions actually happen then? You can hit your head or you can not hit your head. So what does that look like if you hit your head? We often think about this with sports. So football, soccer, baseball, volleyball, hockey, cheerleading, you name the sport, you could end up with a head injury from it if you hit your head, if you hit another player, if you hit the field, anything, any hit on the head in one of those sports can cause a concussion, no matter how hard the hit or how minimal the hit looks at the time. Falls are another top reason for concussions to happen, and this can be slipping on stairs. So in our house, we kind of joke that people have fallen down our stairs so many times because the carpeting is old and needs to be replaced. If you have some old wooden stairs, sometimes that's a really good place to slip. If you're wearing stocking feet, things like that. So falling down the stairs. We live in Minnesota. Falling on ice is a really common one here. So people slipping on the ice and falling and hitting their head. Walking on uneven surfaces. If you lose your balance, fall over that way. Hikers have that happen at times as well. And then I have had the occasional patient that has fallen out of bed or fallen out of a chair and hit their head on something, whether it's hitting their head on the table that's next to their bed or the windowsill if their chair is sitting close to a window, or the floor if they've completely fallen off of it. So that can be from somebody falling asleep while they're sitting on a chair or on the edge of the bed, or not being able to get up very well if they have mobility issues. And then motor vehicle accidents is another one we commonly think about, whether you hit your head on a window inside the car or kind of the barriers between windows. If you hit your head on the steering wheel, even the airbag can have a lot of pressure in it. There's a lot of force behind that airbag to hold your head still. Hitting your head on the ground, whether you are ejected from a vehicle or if you're on a vehicle that has two wheels, or an ATV, something that doesn't have walls that holds you in, if you hit the ground that way. I actually had a patient recently who was in a car accident where she literally was ejected through the windshield of the vehicle. It was a previous injury. That was not the one I was seeing her for. But all of those could end up with a concussion from hitting your head. And then assaults. If you have injury to the head, if somebody holds another individual up against a wall and hits their head against the wall, against a floor, direct hits to the head, any of those unfortunately, can end up with a concussion also. But again, I mentioned you don't have to hit your head. So the hard hit to the torso or that momentum from movement that suddenly stops, such as in sports. Those same sports you can hit your head in, football, cheerleading, you can also have that sudden impact to your torso. That momentum can make your head jostle and your brain jostles inside of your skull. So a hard hit to the chest in football or in cheerleading when they throw the cheerleaders up in the air and they catch them and you see their head kind of jolt a little bit if they're not holding their head super still with that one. You can end up with a concussion just from that movement of the torso and the rest of the body. We also see this with blast injuries in the military. So whether the military personnel was holding that really high-powered weapon or just being near it can also cause that injury. And then rocket explosions right in front of people. I've had that as patient as well. So all of the above can cause those same blast injuries. And then motor vehicle accidents again can cause car accident or cause concussions, even if you don't hit your head, because the whiplash, when you have that whiplash effect, even if you don't hit your head on the chair or on the airbag or whatever it is, you don't have to hit your head to get the concussion. The whiplash injury can also cause the concussive injury on your brain. So you can have a hit to the head, you can not have a hit to the head. Same kind of activities, and you can still end up with a concussion. Again, we used to think people had to lose their consciousness in order to have a concussion. And in the research, that's actually only approximately 10% of individuals that have a concussion that actually lose consciousness. The rest are mostly wide awake. They might be dazed, confused, feel a little off, but they don't completely lose their consciousness. So loss of consciousness should not be an indicator of concussion. And I talked about that in a previous episode of the ABCs of concussion. I really talked about that kind of ad nauseum. So I won't go into that real in depth right now on this one. And what is a mild TBI? So I throw this term out a lot. The mild traumatic brain injury is, according to the research, approximately 75 to 80% of all TBIs. So all traumatic brain injuries, 75 to 80% of those are considered mild TBIs. A mild TBI is synonymous with concussion. So it is the same thing. So you truly can't call a moderate or severe TBI a concussion. It's still a head injury at that point or a brain injury, but it's not truly a concussion. That mild TBI is the concussion level. So briefly talking about our historical terminology when we're talking about mild, moderate, and severe, because that is probably going to be going away here at some point soon. We've been talking about this mild, moderate TBI category for a long time. And to really kind of dumb it down to make it as simple as possible, the mild TBI, basically, you don't have a loss of consciousness. So that by definition, people don't lose consciousness with a mild TBI. That's 75 to 80% right there. Didn't lose consciousness. But I digress. Not a lack of loss of consciousness and no changes on head imaging. No skull fracture, facial fracture, no head bleed. That's a mild TBI. Once you have a loss of consciousness of any length of time up to 24 hours, again, no head imaging changes, that would be a moderate TBI. Once you get to the point where there's changes on that head imaging or loss of consciousness greater than 24 hours, that's when we get into that severe TBI category that we've historically always gone by, the mild, moderate, and severe TBIs. This year in 2025, a new statement came out recommending a change to that classification. So we will hopefully in the near future here be seeing changes to that classification system that really look at the symptoms that affect people after the injury occurs. Because these diagnoses, when we're looking at mild, moderate, severe, are only helpful if we're talking about the injury itself, what happened at the moment of the injury. Because as we talk about today, most of these mild TBIs, quote, mild TBIs, go on to have significant symptoms. So we might not think of mild TBIs as serious, but they are actually very serious. But they're deemed mild because they're not life-threatening. They are, however, lifestyle threatening, life-altering. So even a, quote, mild TBI can make a significant change in somebody's life. As far as a list of TBI symptoms goes, again, this part is really more kind of wow factor when you look at the slide in the presentation that I have in PowerPoint, because there's a list of 4 columns of these symptoms, and I will list them all out, but this is not an exhaustive list of TBI symptoms either. These are the things that we see more commonly. These are the things that I deal with on a regular basis working in a concussion clinic now. So headache, blurred vision or double vision, word finding difficulties, slurred speech, short-term memory issues, forgetfulness, dizziness, balance troubles, coordination difficulties, activity intolerance, sleep disturbance, seizures, irritability, mood swings, problems with focus and attention, fatigue, weakness, numbness, reading comprehension, hearing comprehension, problem-solving difficulties, concentration difficulties, slowed thinking, confusion, word substitutions, depression, anxiety, sensitivity to light, sensitivity to sound, loss of smell or taste, personality changes, hearing difficulties, tinnitus, changes in appetite, nausea or vomiting, and again, the list could go on and on. I did not make an exhaustive list, but it gives you a really good visual when you look at this slide and you see all of these symptoms that can happen with a TBI. No two TBI patients are exactly the same. You kind of pick and choose. It's a a la carte type of thing. Although we don't actually get to pick and choose the symptoms, they choose us. It's more like when you go to the animal shelter and the animal chooses you, you don't choose the animal, things like that. So then when do symptoms appear? And yeah, sometimes right away when people have the injury, the symptoms can appear immediately. So immediately upon hitting their head, they start getting sick to their stomach or they develop a headache. But that doesn't always happen. Sometimes it can be the next day when people wake up that they really realize that they have symptoms. So a lot of patients don't go in the same day that they have a hit to their head or have some sort of injury. It can take days to weeks to identify these, and sometimes even longer. Sometimes I like to say it's kind of like peeling back the layers of an onion. As you peel back one layer and you're dealing with those symptoms that you think that's all you have, once you really fix those things a little bit more, something else kind of bubbles to the surface. And all of a sudden we realize there's more going on underneath. My injury was a good example of this. We thought that a lot of my things were related to headache. So we thought that once my headache was resolved, that those other problems would go away as well. Come to find out that those other problems were actually problems individually, and it wasn't just my headache that was making everything go wrong. There are some red flags to watch for, however. So these symptoms, and I say this because so many people will say, oh, I got my bell rung. I got a little hit to the head. It wasn't really anything. It wasn't worth worrying about. So some people don't go in. A lot of people don't go in and get diagnosed, and they don't get a good, clear picture of what's actually going on. And then sometimes when they do, they still don't get told much of what's going on, but that's a whole nother story. But there are some red flags to watch for. These are things that you absolutely want to make sure that you get medical care. You seek medical care because of these. If you had a loss of consciousness longer than 30 minutes, that is something to be concerned about, and that is something you should probably go get evaluated. Probably you need a head image at this point to make sure that nothing more significant has happened inside of your brain. If the headache continues to get worse, so you develop a headache, it progressively gets worse, that's a red flag. If you have repeated vomiting, if you have slurred speech, numbness or weakness in your arms or legs, that's not normal. Unusual behavior, and this one is a difficult one to kind of define for people. Basically, if you have somebody that's super quiet and really always polite, and now they're cranky AF and they have a really short fuse, that's something to be evaluated. And inability to recognize people or places, so that memory part is definitely a problem. And then inability to wake up. So if somebody goes to sleep afterwards, you can't wake them up. That's when you're driving your loved one to the emergency room and getting them evaluated, because we need to make sure that there's not a bleed on the brain. And that's basically what those red flags are for. That's to give you a flag that you probably need a head image done to make sure that we don't have a bleed into the brain and a more severe form of brain injury. What can we do right away for it? So people ask, well, what good is it going to do if I go get evaluated? There are things we can do right away. And that whole sleeping thing that I mentioned on the last slide, we used to say no sleeping, make sure that you stay awake. But as long as you don't have one of those red flags, it's okay to go take a nap, go to sleep if it's your normal bedtime for going to sleep. The sleep is good for your brain. Sleep helps you heal. The main part why we say we don't want you to go to sleep is in case you have a head bleed. So if you have one of those red flags, absolutely go get evaluated first. And once you've got a picture of your head that proves you don't have a bleed on your brain, go ahead and go home and go back to sleep, because you need that sleep to heal your brain. Do report the injury right away, however. So whether you are in a sport, you're at school, you're at work, report it to your coach, your teacher, your parent, a friend. If you're at work, a manager or HR at work, so that somebody can tell you what needs to be done next. They can get it documented that you had the injury, especially if it's a work-related injury. This now needs to get documented as a workers' compensation injury. So work comp needs to know that you had an injury at work. If you don't tell them right away, sometimes that causes problems for patients with their work comp cases if they did not tell somebody right away that they got injured. Especially if you're at work, you need to tell somebody right away so that that can be dealt with correctly from that injury location. But really, if you have a head injury in any location, it's best to report it to somebody. The other thing you need to do is get that a medical evaluation, and it may or may not include head imaging. There are some protocols in place that look at the severity of your injuries, the severity of your symptoms, and they try to determine whether or not you actually need a CT and or MRI, because they're trying to save you the radiation and the exposure to imaging, save you the cost of those things, and save time. If they don't need to do those image, there's not really a reason for it, they don't think it's going to change management, then they don't do the head image. And some people come to me and they say, well, I've never had my head image this whole time around. And probably that's okay, because 99% of the time, those images are negative anyway. We're not going to see anything. That doesn't mean that you didn't have a head injury. It just means that you didn't have a bleed or some sort of a fracture. So that's really the only thing that we're ruling out in those cases. Once you've had a head image that's normal, again, it doesn't mean that you didn't have that head injury. So then we need to move forward with what we need to do next. And the bigger thing is managing the symptoms. The idea of rest is really important. So I talked about that earlier, just a moment ago, but that idea of rest is really important for your brain. However, we used to tell people to rest until their symptoms got better. We now know that many people go on to have symptoms last for a lengthy period of time. If you were to rest that entire period of time, a body at rest likes to stay at rest, and it makes it very difficult for you to get back into your normal activities again. The current research tells us that you really should rest your brain for no more than 72 hours. Because again, the longer you take out of it, the longer it takes to get back into things. You do, however, in those 72 hours, want to minimize your screen time, because that takes a lot of brain power, being on screens, computers, phones, all of that. You want to try to minimize that screen time. You don't want to jump right back into contact sports and activities. You also don't want to do strenuous activity. That doesn't mean you don't want to do any kind of activity. You really do. So you should try to do something, especially walking. Walking is fantastic. There's a lot of research out now to show that walking is actually really good for any kind of exercise, but we don't want to not do anything those first few days. So walking is fantastic, just nothing strenuous, nothing that's going to get you another head injury, perhaps. And then you do want to take a break from work or school for a couple days, because you need to give yourself time to heal. Some people need longer than a couple days, but we really should start with a minimum of those 72 hours. And then you should return to your cognitive activities prior to returning to harder physical activities. So think of it as school or work before the sports, because you want those cognitive things are what tends to be more problematic for people. You can't do both at the same time introducing them. So introduce those cognitive activities first, and then gradually increase the activity as you can tolerate it. There are lots of protocols with like the CDC Heads Up protocol for returning to sports. It really lays out what their symptoms look like and when they can return from non-contact to contact sports in there. So that's really well laid out. It's more so the return to other activities, or if you're not in a sport, you're not in a youth sport especially, you're not following the CDC Heads Up guidelines on that, then you don't have somebody kind of telling you what to do on that. So gradual return is best. So how long is it going to recover from a brain injury? How long does it take? And many people do recover within days to weeks, but not most. We've always said that most, and the grand majority, have recovered within those 21 to 28 days, but that is not true. Many will recover longer than that. Many take months to years or more. We now know in all the research that greater than 50% of individuals that have a head injury continue to have symptoms beyond a year. And 30% or more of individuals have something called persistent post-concussive symptoms, also known as post-concussion syndrome. So that's a lot of people to still have symptoms well beyond that 28-day mark that we always thought that people recovered in. So now it explains why I can have almost a full-time position now, working on getting back to full-time as a concussion provider, and why we need so many more concussion clinics around, because this many people continue to have symptoms and needs for healthcare. There are some factors that can affect that recovery time, such as history of previous head injury. So if someone comes in to see me and they've had a history of multiple other head injuries, chances are it's going to take longer for them to recover from this current head injury. That recovery time tends to prolong with each subsequent injury. And with each subsequent injury, that likelihood of you getting back to your original baseline decreases a little bit. So you kind of need to develop a new baseline after a head injury that may or may not be close to what that old baseline was. And again, if you continue having head injuries, that baseline is going to move, can continually change. That pre-injury state, there are a lot of other medical diagnoses that can be correlated with a prolonged recovery from a brain injury. Things such as anxiety, depression, and migraines are very highly correlated with prolonged recovery from any kind of brain injury. Unfortunately, it doesn't mean that you can't recover from it. It just means it's going to take a little bit longer. Gender, biological gender differences do play a role in head injury recovery. Biological females tend to have longer prolonged recovery times than biological males, and they tend to have more cognitive effects. So the memory, the thought processing, all of those things tend to take longer to recover for biological females than biological males. And then it's kind of like a pre-injury state, but not really. But if you have an injury that you also end up with PTSD, post-traumatic stress disorder from it, PTSD with TBI tends to lead to a prolonged recovery from the TBI. So that's why in my practice, I'm always talking to people about that PTSD and about the need for treatment to recover from that part of it so that your brain can heal from the injury. Because that emotional injury will often supersede the healing from the physical injury in the brain. And then the mechanism and severity of injury also play a role in recovery time. If there was any kind of rotational force, so if you had your head turned when you got hit, or if you're looking at the car from a different angle than straight ahead when you got hit in that accident, which actually happened with me on that rotational force tends to prolong your recovery. Because again, there's a lot of different fibers in the back part of your brain that can get injured that take longer to recover. And then as far as treatments, so historically, we've always thought of like OT, PT, speech. OT, again, historically has been for the activities of daily living, getting through your bathing, cooking, things like that. PT has always been thought of for physical ailments, the larger muscle movements, so balance, neck issues, things like that. And then speech therapy was often thought of for the speech problems. If people had problems with their language, forming words, that was kind of where that was thought of. I'm going to add on to that a little bit because OT, occupational therapy, can also do vision therapy. And that's a lot of what I refer people to now is the vision therapy side of things. Less so the other little cognitive parts that they're working on, but really for that vision therapy piece. Physical therapy, yes, they can do balance work. They can do vestibular things. They can work on your neck issues. They can also, some of them do things like dry needling or microneedling, where the microcurrent type of treatments where they're doing additional treatments outside of just the physical exercises that we often think of. And speech therapy, yes, they do a lot of things with speech. So speech language pathology is the full name of that one. And yes, they can work on speech issues, but they do a lot with cognitive issues. So people that have memory struggle with trying to remember things, trying to learn things. That's a part of language also. So that gets into the speech language pathology realm. So lots of bigger thinking for those three right there. And then beyond that, there's a whole host of other things that we can do that some of that is new in the research. Some of it's just new in getting into people's practice and getting into people's minds. But neurooptometry and neuroophthalmology are two different things. And when you look at kind of the definition of what they look for, neuroophthalmology tends to be involved when there might be a surgical type of treatment. They tend to be involved when there is like optic nerve damage, such as with multiple sclerosis, things like that. Neurooptometry looks more at like the therapy side of things. They will prescribe things like prism glasses and vision therapy. So getting to the occupational therapist for the vision therapy part of things. Some neuro-ophthalmologists will also prescribe prism lenses, but I tend to see this done maybe a little bit better in the neuro-optometry realm. So they both play their roles in recovery for different purposes a little bit. And I did have a neuro-optometrist, Dr. Michael Wallerick, back on my show. If you want to go way back to episode 60, he came on and we talked about different things that you can see with vision with a concussion and a head injury. I think he's advanced his talk even more so since then. So if you've seen Dr. Michael Wallerick presented anything, at least locally wise, and he's gone to some national conferences too. I'm not sure if he's presented at some of them, but he is just a wealth of knowledge on the neurooptometry side as well. And then acupuncture. Acupuncture can also be really helpful for the pain side of things with concussion and head injury, as well as just brain injury in general. Did have someone who was trained initially in acupuncture, Dr. Ayla Wolf, on in episode 144 on the show, and we talked about acupuncture and functional medicine as well. So a really good conversation that episode. Cardiology can also be involved for things like testing for POTS, dysautonomia. A lot of that can be done in cardiology. Some of it can be done in neurology as well. So they kind of share that role a little bit, but cardiology can very much be involved if somebody has that autonomic dysfunction and they have issues with now tachycardia, palpitations, making sure that we get a really good, thorough evaluation on what's going on with their cardiac side of things. And audiology is also another really important one. Audiology, we hear a lot of people reporting ringing in the ears, the tinnitus. The other thing that we don't often think about is auditory processing disorder. Back on episode 142, I had Dr. Heidi Hill on with me, and we talked about auditory processing disorder, when you actually can't process the things that you hear very well, or if in busy situations it's difficult to process what you hear because your brain essentially gets confused, and you have to then figure out how to treat that. There are ways to test for it, and then there's ways to treat it. Beyond that, kind of segue with that too, is ENT, ear, nose, and throat physicians. So sometimes with that tinnitus, with that ringing in the ears, sometimes there's a structural problem. Audiology is going to work on the nerve side of things, where ENT is going to work on the structural side of things. So if somebody has a damage to their inner ear, if they have a dehisced canal, which I've seen happen with a couple of my traumatic patients now, they have an actual canal dehiscence, and they have to have surgery to correct that. So that's kind of like the neurooptometry, neuroophthalmology. ENT audiology has that same kind of connection, the surgical side of things versus the nerve side of things. So that might be another referral. Photobiomodulation, also known as red light therapy. So red light therapy can be very, very beneficial for waking up the mitochondria so the body can heal appropriately and getting the brain blood flow back to where it should be to allow the brain to heal. If you want to learn more about the photobiomodulation, back on episode 57, I had Dr. Cinecropi and Tram Holloway on the show with me, the owners of Hypercharge Wellness and Hypercharge Health now, talking about all of the therapies that can be done there, which also include the photobiomodulation for treatment of concussion. We talked about my own experience with it at that point. Neurofeedback. So this is a little different thing we covered on the show actually a couple times now. I had Minsan Sowers from Minnesota Brain Solutions on back in episode 96, and Dr. Andrew Hill came on at episode 100, both talking about different aspects of the neurofeedback and how it works, and both great episodes to talk about the electrical changes that can happen in a brain with somebody that's had a brain injury and how we fix those electrical ailments in the brain. Also very, very cool. There's another episode that just came out recently with the PRTMS, kind of a offshoot from neurofeedback, essentially, because it also uses EEG technology, a different type of EEG technology. That was a more recent episode. Also another thing that could be listed on this whole little list of referrals that I have here. We don't have it in Minnesota very well yet. So that one's coming, hopefully at some point. Support groups, super, super helpful for people who are trying to recover from brain injuries. And it can be a local support group. It can be an online support group. Local support groups might be face-to-face. They might still be virtual in some settings as well. There are local support groups for people that have worked in professional organizations before, and that's a different kind of recovery necessarily sometimes than just the general population, because you went from this really, really high functioning, you took care of other people, to now you are the patient side of things. And that's a whole different aspect of healing. I can tell you that from personal experience too. For online support groups, there are groups like Hope Survives and Love Your Brain that both have options for some of that mindfulness and kind of guided support group thing there too, among other organizations, but those are some really good ones. And I didn't write down the episodes on that, but Love Your Brain actually was on the show, and I need to get Hope Survives on here too. So beyond that, mental health is really, really important, as we've talked about so many times on this show. The mental health effect of somebody with a brain injury is just huge. It's monumental. I can't even put a value on it because it's so important to get the mental health supported as you go through a brain injury because of the grief that we've talked about before, all of the changes personally that happen, and dealing with the PTSD. Mental health therapy in general is really important, and things like EMDR or ART therapy. ART therapy is an episode that will be upcoming in the next month or so here. So we can talk about how to deal with PTSD because, again, if you have PTSD and TBI at the same time, it slows down that recovery. So we want to do things that are going to speed that back up again. And then neurological chiropractor. I would be remiss if I did not talk about this one, but neurological chiropractor Dr. Brandon Allen came on here on episode 151 to talk about the different kinds of therapy treatments for that neurological chiropractor standpoint. And it's really phenomenal how people have gotten better once they've been able to balance their autonomic dysfunction, balance some of that vestibular issues that they have that they've not been able to get over from working with PT and OT, and they still continue to have these issues. It's just a different way to look at it, a more holistic approach, a more functional approach to it. So all sorts of different things that we can talk about. Another really common referral that I'm placing now is to the Minnesota Brain Injury Alliance. The Minnesota Brain Injury Alliance, I had Alec Wendelboe on to talk about resources back on episode 58, long time ago on the show. Minnesota is a great resource for Minnesota Brain Injury Alliance is a great resource for individuals with have a brain injury. There's a resource facilitation program in our state that the individuals that are injured have support to make sure that they have the resources that they need. I utilize that as part of my healing process, and I refer patients to it now. Not every state has that resource facilitation program, but most states do have a brain injury alliance or a brain injury association of some sort that can help people with resources. So another really, really great resource for that. And then finally, how do we advocate for ourselves or for others? So I've given you a lot of information today of just kind of the basics, what to do. On the ABCs of concussion, we talk about different topics every week that we have it on, not every week, but every week that show comes on, we talk about different issues related to brain injury, whether you are the person with the brain injury or your loved one or somebody that you know that has the brain injury. There are ways that you can advocate for yourself or for other people and using some of these techniques I'm going to list out here for you in a moment. Again, if you're the person that's injured or this is your loved one, it's more for the injured person. But again, if you're the loved one, take notes so that you know how to help them. Document everything. Document your symptoms. Document the appointments that you go to. Document the medical decisions made at all of those appointments. That might help you should you need a legal case moving forward, but it also helps you organize your life and it can help you communicate with your loved ones. So if you are the person that had the injury and you're insisting on going to all of your medical appointments alone still, but you're having issues trying to remember things, if you document all of those things, that will help you communicate with your partner, communicate with your loved ones so that you can get the best help possible. Getting second opinions. It is not wrong to ask for a second opinion. If you're not getting the answers that you want and or need, ask for someone else. Keep searching until you find someone. There will be somebody that can answer your questions. It might not be the person you're sitting in front of right now at the doctor's appointment or at the provider's appointment, but you might need somebody else. So ask for that other person. If you are injured at work, ask for a QRC. I can't remember the exact time frame that I was told by one of my patients, but the employer legally does not have to tell you about a QRC. I want to say it's like 2 months, 2 or 3 months. They legally don't have to tell you. At that point, they have to. But a QRC is a qualified rehabilitation consultant. They are paid by the insurance company to help you get back to work, make sure that you get your appointments, make sure that you get your follow-ups set up. If your provider refers you to somewhere else, that QRC helps to make sure those referrals get put in place. If you have equipment that gets purchased, whether it's glasses or a machine or some sort of support, the QRC helps to make sure that the payment gets through so that you actually get your medical equipment that's going to help you heal. That QRC is this magical person that can come sit in your appointments with you and take notes and advocate for you as the individual that got hurt at work, to make sure that you have what you need in place. They help you make sure that you have any accommodations that you need to get back to work. They are that help that will help you get back to work. I can see you all I want, make referrals all I want, but if they're not getting approved by your adjuster, then you're not going to get the help that you need. A QRC can help get that adjuster's approval on things so that things move smoothly for you. I've seen some QRCs be incredibly helpful, some that maybe are not quite as qualified as the others, but some that are really, really good at getting the help that you need. And you're definitely better off with one than without one. So I always encourage my patients to ask for one if they have not yet, and especially if nobody's told them about it yet. If you were injured in a sport, or if your loved one was injured in a sport, you need to communicate openly with the coach, with the athletic trainers, with your teachers, to again make sure that you have the support that you need. This is no longer the time where we want to say, oh, I just want to get back out there on the field, because we now know that if you get back on the field before your brain is healed, you can start to have some permanent changes that no longer can be fixed because you've had injury upon injury. That second impact syndrome, we start to get permanent changes in the brain. So we don't want that to happen. We want you to be at your highest functioning self. My oldest son played football for a while, and I had friends that would harass me and say, well, what if he gets a concussion? So, well, we have a plan in place that he will not stay in the sport if he gets a concussion because he wants to go to college someday. We need to make sure that we protect that brain. And then they say, well, aren't you afraid he's going to tell you that lie and not be honest that he didn't have a concussion? And I would look at people and I'd say, do you remember what I do for a living? I'm pretty sure I would identify if he had a concussion. And he never got a chance to have a head injury because my child is more like me and we are very prone to injuries, and he hurt himself in other ways. His knee, his ankle, his wrist, but he never got a chance to hurt his head, thankfully, because he's now in PhD school. So there we go. We protected the brain. It worked. If you are injured in a motor vehicle accident, how can you advocate for yourself or for other people? You might need to get legal advice or legal support to help you through that accident because they will help. We talked about legal in one of the last ABCs of concussion episodes as well. So making sure that you have that support that helps you to get the financial support that you need so that you can heal and get back to your normalish life at sometimes. So it's really important to get that kind of help as well. Again, document all of those other things that we already said. And then educate yourself. You as the individual, you as the family member, you as the caregiver, you as the person that sees somebody that's injured beside you, make sure that you educate yourself. There are so many organizations out there now providing a lot of education, a lot of it free education for the public. Again, Love Your Brain has a lot of things. Hope Survives does a lot of things. There are several other smaller organizations like that, or individually run organizations. The Brain Injury Association of America does a lot of education. Here in Minnesota, the Minnesota Brain Injury Alliance offers a lot of educational support and resources, including free conferences for family members. That's coming up this coming weekend, actually, here in Minnesota, the day after this episode comes out live. Lots of options, lots of opportunities to get educated about brain injury. And again, if you are the person that's injured, if you are the loved one, if you're the caregiver, if you're a healthcare provider, you really need to educate yourself on all of these, because the last couple of years have been just gangbusters for research on brain injury. There is so much coming out, so many new things, and I'm reaching out to so many different organizations. As you can see probably on all of the episodes that we've had on this show, is that there's just so much coming out, so many new things, so many really cool things coming out for brain injury. And I'm excited to be in this world at this time because there is so much going on and so many opportunities for health and healing and growth for the individuals, growth for us as healthcare providers. And it's been a lot of fun to really learn and grow and try to help my fellow caregivers in this space too, and help the other providers in my practice get more knowledgeable on how to deal with concussion patients, because I send out a lot of information. Hopefully they don't dislike me for all the emails that I send out with, here's another resource for you. So there's a lot that we can do for people. And that's a lot of what I get thank yous from patients, is when I identify that there's still things that we can do. There are a lot of things that we can do to help your brain heal. You just have to be open to it all. So that is my Head Injury 101, plus a little bit more as I kind of look back on the different episodes to remind you where you can go back to look for more of that information. Brain Injury 101, Head Injury 101, however you want to look at it. It's near and dear to my heart. It is my latest passion. So thank you for listening, and I hope you join me again next week. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.